Well, thank you for joining us. My name is James Barta. I am now with the Oregon Eligibility Partnership, but do community engagement either way for self-sufficiency or OEP for now. But I'm also getting over a case of COVID, so if I'm not 100% here, then you'll understand, I hope. I'm going to tax my abilities here to make sure that we are spotlighting Amanda, who is doing our ASL interpretation. So she has some notes in the comments section. So if you need to pin her, please do so, but I think it should be readily available. I'll be pinning speakers as well. So with that, welcome. Thank you for joining us. And I want to give the first few minutes to one of our partners who was kind enough to agree to describe her organization or work. Melanie, if you want to take it away, please do so.
Okay, great. Yeah, thanks very much for the invitation, James. And I am really happy to see you upright and communicative. And I wish you speedy recovery from here on out too. I'm on another committee with James. Actually, I think he's having to step down from that one, but he was helping facilitate a anti-poverty work group. And so that's how we got to know each other. I founded a little nonprofit in the Portland metro area called Assist, and we help people with the horrible SSI, SSD application. We are non-attorney representatives, but most disability attorneys out there only work on the appeals for that system. And I started Assist 12 years ago to help the neediest and sickest of our folks that can't even get through the application. It's a federal system that spits people out pretty fast if they don't get paperwork back in time, or they don't have all of their answers to their application question and that kind of thing. So we are a nonprofit, but we do right now, until I get more stable funding, we do charge fees for our work. Anybody can refer to our program that's in the metro area. I want to talk real briefly about the fees, because in Social Security world, the fees is a very strange thing too. So I hope this is helpful information for you guys. But fees are only collected when we win a case. And from the time someone starts a disability application, all the months or sometimes years that it takes people to get on benefits, once they're approved, then people get a large lump sum retroactive benefits amount. And our fees come from that retroactive lump sum fee or payment of benefits. And that fee is capped by the feds of 25% of that back pay. So it's a very weird thing that people think they actually do have to hire us if we enroll them in our Assist program. But we only get fees paid when the case is won. They're called contingency fees. So the fee structure is pretty weird in that it ends up being a disincentive for people to apply, or excuse me, to let me put it this way: a disincentive to advocates like disability attorneys to sign someone up and help them get through the application and win their case without any appeals, which is what Assist mission is. Because the longer a case languishes through the months and months, sometimes years, oftentimes years, the larger that representative fee is. Well, we're working with the sickest of the sick and the poorest of the poor for an SSI applicant, and I just can't abide that. So we do charge fees, but the better we do our job and meet our mission, the less we get paid. So that's not really a good business plan, but I want people to know that there's very few resources out there to help people with the actual application itself too. We win 70% of our cases without any appeals. And when I tell that statistic to disability attorneys out there, they just don't even believe me. We're super proactive. When we do enroll someone in the ASSIST program, we are all in and we are dogged until we get, we try to plug every hole in the system so that our super indigent people will get their benefits as soon as possible. I'll keep it quick here and just give you our website, programassist.org. We are also, it's very hard to get Social Security on the phone too, so we set ourselves out to be an information resource as well for this program. So don't hesitate to call with questions. There's a tremendous amount of misinformation out there or misunderstood information out there. And we are experts at that, at this. I've been doing it for 20 years. And this is my second team of non-attorney representatives that I've trained and established. And we do not hesitate to help people understand this system if they need to call us for some advice even. So we have a referral form that's on our website. Again, I'll give that programassist.org. I'll type it in. I'm going to stick around with your meeting, so I'll type that in as soon as I get done here. But we ask that anybody that wants to have us review their case for possible enrollment into our program, that on our website, there's a referral form, just a 2-page easy website or easy form with some basic information on it. And we keep track of all the referrals we get, and we get a lot of referrals. We carry about 120 open cases at once at any one time. And so whenever we win a case, we have another slot open to add another person. So we're constantly reviewing new referrals. And with that, I don't know, James, do you want me to open it up for questions or just call it good for now?
Yeah, if there's any quick questions, I want to thank you, Melanie, for your work and speaking up. This is often the back end of the last line of defense in a sense of helping people is getting them Social Security benefits. Kathy, you have your hand up.
Yeah, I was wondering, is this just for people in the Portland area?
Yes, unfortunately. We do a lot of outreach for our indigent clients. We meet people in hospitals and homeless shelters, and we take mountains of forms for them to fill out where they're at. And so we can't extend too far right now, but as James can attest, I'm trying to help DHS State of Oregon expand this service a little further out into all of Oregon, because we get asked that question all the time, as you can imagine.
Thanks for the question, Kathy. So, well, we're going to move on to the next item on the agenda. I see Nate is with us, our Executive Director of Oregon Eligibility Partnership. So I will ask you then to take it away.
And I will be introducing Jillian Johnson. And Jillian, I didn't talk to you. Jillian, do you want me to share the PowerPoint as we go through it?
I got you.
All right. I want to really quickly say hi to Melanie. It's been several years, and just as we call out something that always found interesting, those that don't know, disability determination services who determine if someone has a disability for Social Security in most states work for agencies. So ODHS actually has the staff that for SSA do the disability determinations. And so Melanie has been an advocate working with that group and other groups to really push these services for a lot of years. In my previous role with APD, I had an opportunity to sit in some meetings and listen to that advocacy work. So appreciate those helping individuals get to their correct benefits and trying to help improve the system. With that, I'm Nate Singer, the OEP director, and I'm gonna have Jillian Johnson share who she is, and we'll have her kick off and I'll jump in. You're muted, Jillian. Still muted. I could pretend like I'm
Okay, how
saying
about
it for
now?
you. There we go.
When you share your screen, your mute button moves. Learning stuff every day. Hi, folks. My name is Jillian Johnson. My pronouns are she, her, hers. It's really great to be here with Nate and to be given an opportunity to give a little bit of update and then have a chat. So I'm going to talk super briefly about some customer service improvements and efficiencies. And then Nate will take over for a little bit and talk about some of the data around customer service. And then I will give you some updates related to the ending of the public health emergency. So I just wanted to share this slide super briefly. It outlines some of the different customer service improvements that either have been put in place or are being put in place. Both the language access line and the callback option have been implemented. The additional things such as moving through a process for updating our return mail, for creating interactive voice response, which is basically when you call and you say, you know, tell me my balance, right? And then you never have to talk to a person. Those types of things you often see with different places you call, and launching of a mobile app for one, which we know is going to be really critical given that a lot of individuals access the internet not through computers. So I can give more information later on if you're interested in hearing more details about those innovations, but wanted to start there, and then I will hand it back over to Nate to talk about the next couple slides.
And now I had to get to my mute button. So yes, appreciate that. You know, as we talk about those innovations, many of those technologies tie together, and it's pretty neat to think about it. We get a lot of return mail, and one of the things that will be coming out is that we will be able to read a code on that mail, automate the scanning of it, and then do automated outreach to individuals. So if an individual has said, you can text me, you can call me, they've given, you know, permission for us to do that, we will then have automated to be able to say, hey, we got returned mail, do you have an updated address? And if they have that mobile app, we can literally say, log in the mobile app and update your address. Those are places, you know, we're trying to find ways to help Oregonians keep their information up to date and hear what's happening. And part of that's really to support just the massive amount of work that we have. So we've shared this graph as we've met with you all. I will put into the chat because I always want you all to know where you can find it. We publish regularly data around what we have. As Jillian talks about PHE, she'll, I'm sure, touch on, you know, dashboards and data as we get through some of this, but we want people to be aware of what's happening. So related to all the programs, you can see we've been tracking over the last year applications that are past their federal processing deadlines. So we have specific processing deadlines. So when you look at 45 days, 30 days, 7 days, 45 days, I want to be clear, those are federal processing timeline requirements. That doesn't mean childcare applications are averaging 45 days. We have 45 days from the date that we received that application or data request to make sure we have processed it. And we have some applications that have continued to move beyond it. So these are not, again, the same applications. They're not the same applications, you know, from December that we hadn't gotten to. Other applications come through as we work them. So you can see we had some significant drop in July where we're able to implement some, again, systematic things to really help us watch and work through it. But then around August, September, we start to see our cases and applications climb again. This is something that we see over time quite regularly as seasonal work starts to change. As people potentially lose some of those seasonal work jobs, we start to see them require some additional assistance. We also, in October and November, as we start to have open enrollment, that obviously takes some of our capacity away as we work this, but we're continuing to serve just a historic number of individuals. And that unfortunately is causing, even with all the improvements we're trying to do for efficiencies with systems, we just don't have the staff to really truly serve this. We've added over 30 34%, almost 35% growth in medical Medicaid alone during the pandemic. That's over 350,000 more Oregonians. And so being able to continually support them, seeing additional 24% growth in our other program areas, those are adding to some of the strain. But we're watching this, we're taking different actions to try to watch through it. And we want you to be aware that as you work with your partners, with those in the community, as you advocate, you could be aware that we are watching this information. And I will again post where you can see some of this. To break down those who are trying to do the math on that graph, and again, we'll share, if you go to the next slide, Jillian, sorry, I forgot that I clicked the button and I was like, oh yeah, I'm not clicking the slides. I forgot for a second there, yes. So as you look at this, as of December 2nd, we have 5,659 applications past their federal processing deadline. That doesn't mean that they are all out of compliance. I always want to emphasize, sometimes applications can be past that deadline. We put those dates in there, and it could be for valid reasons. We are waiting on the Oregonian. We've extended their time frame to provide us pending information back. And so it could be for reasons like that. But in many cases, we know we are waiting and staff are trying to work through it, or we are having to still take state actions. And so you can see the split of where programs are and which types of programs are looking at related to this. You know, as we look at this, every single one of these services are critical. That's the hardest part of eligibility in the work we do. You can't say childcare and the fact that an individual could lose a job because their kids can't have childcare versus medical, and if someone that now has diabetes and needing that critical treatment so they don't get hospitalized to relate it to a family needing to eat. I mean, every single one of these situations, unfortunately for us, it is those critical basic areas. Yes, Jillian, clicked scrolled, she did that. So if you want to click down to the next one, down to call times, wanted to just give an update of where we all are for call times. This is also one of the areas that we share and go over with this. This is just for our one customer service center, so the 800 number. I want to emphasize again, with eligibility, part of our goal of the one system was to create more points of access and options. You can still go into any APD, AAA, or SSP office. So if you've engaged there, they should be able to, and you can go to any of them now. You can go to an APD or an SSP or AAA. You can call the 800 number, you can apply online, you can fill out paper applications. All those are options available to you. And so I just wanted to emphasize that those are all options available. For 800 number, these are current call times. And so you can see we saw a dip in January, February, and March after open enrollment as we were working through it in the previous years, and we've seen some up climbs. What I can share to show some positive towards this is that as an agency, we've done a staffing move to start to hire beyond our legislative authority. We said, we're just going to keep hiring and try to keep hiring in this market to be able to work where we can within our budgets. As we've done that, November of last year, you can see for support queues was close to 60 minutes in wait times, and in other areas, it's been able to be reduced as we're moved into November, so a year later. And that's while we've just seen still historic demand of inflation and other areas with the public health emergency rules. So our average times as of November 27th are listed here, 18 minutes, 33 minutes, and 9 minutes. But I always want to show max wait times because I wanted to emphasize that some people, if you do the math on this, waited over 2.5 hours. That was the maximum someone waited on that line before they answered. That is not acceptable. That is not our goal. Unfortunately, with the demand that we have, it's hard to try to staff up and be able to move through there and answer all their questions. And so that's why, as an agency in our agency requested budget, we've requested, you know, not all the staff we need, but an investment to say, at minimum, fund us for the positions we're hiring. We asked for several hundred new positions so that way we can continue to try to drive down, because we've seen by adding staff and other things, these numbers come down. But an individual could have waited multiple hours before they came on, and we're still seeing only the ability to answer about 52% of our calls before someone gives up on us. We have put in virtual hold now. And so while someone still may wait 3 hours, and that's the way we're going to continue to report it, they don't have to wait on the line any longer. They have a choice to be able to select and say, have a call back. And so they will call back related to that. And so those will be some of the stats we share as we move throughout the future. I see some questions in there. I'm going to look at the questions so I can be prepared when we get the questions, but I'm going to switch it over to Jillian for a minute to talk through the PHE and some of that unwinding, and I will respond to some of the questions in the chat, and then we'll have open time to just answer the questions and go through anything we don't answer.
All right, sounds like a plan. So wanted to give a little update on what's been happening around preparing for the end of the COVID-19 public health emergency. So PHE is the shortcut that I'll use as I'm chatting here. As we unwind the PHE, the goal absolutely is preserving benefits. How do we keep those benefits flowing out to individuals and families that are continue to be eligible? And how do we help make smart, compassionate, and clear coordination and connections for them when they may not be eligible? Really, the burning question that everyone sort of is wondering right now is, when will the federal PHE end? When will the public health emergency end? The reality is we're not sure. We don't know. We know that we will be given 60-day notice prior to it ending. And that's about what we know. If everything follows the same pattern as it has, then the next expiration we're looking at will be in April. However, the current federal expiration date still is January 11th. That being said, there's less than 60 days between now and January 11th. So we know it won't end then because we have to get 60-day notice. So there you go, clear as mud. The important thing is that we'll be required to redetermine all individuals who have medical benefits, both Oregon Health Plan and Medicare Savings Program, in 14 months after the public health emergency ends. It does give folks an extra 30, 60 days, total of 90 days to respond and coordinate with the agency when it's time to renew medical benefits. We've been doing a lot of preparation and planning to be ready, everything from supporting our workforce to doing a lot of efforts around trying to make sure we have updated and current contact information to everyone. Some of those one customer service improvements that both Nate and I spoke about, like the callback option and language specific lines. We have a toolkit for partners, and the email address, the website address is there on the slide, and we can share these slides afterwards if you'd like. We're also taking a phased approach by population for these renewals. And that's something that is pretty critical to understand, is that during the public health emergency, we've been renewing everyone's medical benefits in terms of reaching out to them, trying to have a conversation, trying to verify information. However, no one's closed, because that's what the public health emergency basically allows us to do. And I'm talking very general here. So let's say that in December, you're an individual who's contacted by ODHS, told, hey, we got to talk to the agency about getting information to renew your medical benefits. You know it happens every year. You do that. Public health emergency ends, for example, in April. And you get a letter in May saying it's time to renew your medical benefits, right? So that's an entirely possible scenario. And so that's something else that we're just sort of helping partners understand, is that it could be less than that typical 12-month period, because we are trying to phase in we're taking specific populations and spreading them throughout the time to try to allow the individuals that have the most likelihood of retaining benefits towards the beginning of the period, and those who are most at risk or have the biggest barriers for engagement that could result in losing benefits towards the end of that period, as then sort of spreading everyone else out in between. I mentioned the partner toolkit. Partner toolkit is posted online, at oregon.gov/COVID-PHE partners. I will absolutely share this slideshow with James so he can get that out for you. So I don't have to go through the dot dash blah, blah, blah. It's available in 13 different languages. There are downloadable resources that you can use in any communications that you're having with individuals that have medical benefits. They're ready to use right now. There's also SNAP impacts that could be tied to the end of the public health emergency. And one of the toolkits that is provided is really some infographics and some detailed information about what it actually means. We also have a more in-depth sort of partner version that I will get to James to send out to you, because it sort of goes over all the different types of programs and what the potential impacts are. And I think you'll find it really useful. And then one last thing, around opportunities is there is a monthly webinar around the public health emergency that it's a joint webinar put on by OHA and DHS. The next one is this coming Tuesday, and really gives information on exactly what we're doing to plan, what kind of tools, and then there's a lot of opportunity for questions and feedback. And then, you know, you've heard this, hopefully this sounds like old news. If it does, I hope it does, because that means we've been doing our job. We're trying to keep folks' contact information as updated as possible. We're encouraging people to check their mail if it comes from the state of Oregon. Don't recycle it right away, right? Like, you got to read it. And if folks do get a renewal form, really filling it out right away and coming back in and connecting with the agency is going to be important, because like Nate was talking about, our workload and our inability, our workforce has not kept up with the workload. And so it's creating a lot of these delays. And that is with public health emergency provisions in place. So we don't know quite what to expect, but we do think that there could be more barriers to timeliness. And so the quicker that Oregonians can get information in, the better for all the folks. All right, so here's the websites, et cetera, but we'll share that. I'll stop sharing my screen so you can see Nate's thoughtful face, and we'll transition to see if there's some questions.
There are. I'm going to point out a question to you, Jillian, first from Beth Englander. I'm asking, could you please point us to the OHA public facing messaging about updating your address with OHA to make PHE unwinding work? Do we have a link to any of public facing messaging around that?
Sure. Let me get that and put it in the chat.
All right. And then as we talk PHE, Jillian, if you want to help me around this. So Susan had asked around ABOD waivers, and I'd mentioned emergency allotment. You know, they'd heard January and then March. So we hear a lot of dates around that. What I'd shared is that from a state perspective, we continue to ask for those benefits to continue, or those waivers to continue throughout the period of time that we're in the pandemic or emergency declaration. Do you have any other updates you want to provide around those two areas as you think about emergency allotment? And for those that don't know, if we have questions about ABOD requirements, we can go further into it, but around those waivers around work requirements for that population.
So around ABOD, what we know is that it hasn't been extended yet. So we're anticipating March, right? Preparing for March, but are not sure. And we have not heard from the federal government a confirmed date around that. So we continue to plan and prepare and hope that it gets extended further. The other one around emergency allotments, those sort of things. Now, all of these extensions, right? Oregon applies month to month for the emergency allotments. And so month to month, we hope for approval. However, as soon as the public health emergency ends, that's the end of those approvals. We will be able to give emergency allotments for 1 more month after the public health emergency ends. And then that's it. We can't request for any more. So any month, those emergency allotments could end for sure within the month after the public health emergency ends. So that's sort of what I know about both of those SNAP impacted programs. And it's going to be, I don't have to tell you how impactful that's going to be for folks.
Thank you. Really quick, and I know we're close to our time. Melanie, you had put in a question about disability referrals. Do you, just defining, are you referring to disability? I always just want to check the Social Security disability process, of course, is separate than this. Are you referring to Medicaid disability referrals or PMDDT, or which processes?
Exactly. In the one application, if there's any questions about disability, does that information go anywhere into your state level disability programs? Are there actual internal referrals? How might that work?
Yeah, no, that's a great question. So, and again, thank you for clarifying as we look at this. So when you apply now, one of the things we wanted to do is, and I always describe back to how it was, when you applied for medical, when Affordable Care Act rolled out, applications didn't talk to each other, things didn't talk to each other. And so you could easily miss out some of those pieces. OHA, when they chose their state plan version for Medicaid, they chose an option that's called the streamlined application. That doesn't mean streamlined the way I think about streamlined. It took me a lot of time to get this through my head of going like, but streamlined is fast and easy, and this is not fast or easy. What they mean by streamlined is that all parts connect to each other throughout and it has a flow through it. And so, yes, it does. What ends up happening for us is if you apply for medical and you're not eligible for the earlier areas, such as modified adjusted gross income. So, and some kids with developmental disabilities, their families, this is part of the strain they felt because we're having to look at tax information on their parents and they're saying, we don't want you to, we just want to look at our kids, you know, our kid has this here. If they have SSI, that's easy, but if they don't have that SSI part, you know, we have to first look at the family tax for the Magi, and then we can get down to, it will go to our, it's called a presumptive Medicaid disability determination team. There's an internal referral goes to them. They work specific tasks around that. We are about to automate some of that. So it's just some of the internal clicking and handing offs that we're taking time. So that way it'll hopefully cut down some of the time. So PMDDT, that team or presumptive team can respond. So disabilities do flow through there to be able to make those determinations. I always just want to emphasize that I know, Melanie, you know this and several others on the call know this, but we do our presumptive determinations while we wait for Social Security to make their determinations. As I mentioned, it's a strange thing, and it took me a while as I learned this, you know, we might be part of the same agency, but these are separate programs under separate authorities. So we sometimes have to wait for those, but we don't want Oregonians to wait. And so we will make those presumptive decisions based on the records and move through. So it does transfer through it. We have some ways to improve on there. And so again, hopefully one of the things you'll hear from us in the future, some of the forums we'll be setting up to really be able to hear more feedback. So not only hear the issues, but hear how you would like to see it. What are those outcomes we're looking for? Help, you know, really release that power for you all to help steer it through so we can do it better.
Yeah, any family members of TANF recipients should be referred to the pre-SSI team, and general assistance, I think, is, you know, like I mentioned in the notes, 100%, almost 100% of the people that get referred to my program are already on OHP. So that's why I was curious about that. Thank you.
Thank you. I know we're responding to some. Are there any questions people want to? We'll stay and look through chat to make sure we're responding to things in the chat. But if there's any that you want us to respond to verbally, want to give a second before we hand it back to James.
Well, Nate and Jillian, I really appreciate you guys being here and answering these questions and working the chat. If you can stick around, that'd be great. We'll probably have a little bit of time at the end to if you can stay that long. But this, and it sounds like we'll be having you back on a fairly regular basis. So thank you for that. And Donna, I know you were under a little bit of a time restriction, so we'd love to have you speak about, instead of college students, we're talking about older Oregonians. So.
Well, hi, thank you all for inviting us back, inviting me back anyway. I don't really have a whole lot prepared. I just wanted to make myself available if you have any questions. Unfortunately, I do have to jet out here in about 6 minutes. I have to go get my COVID booster. So, but I am, able to tell you a little bit about SHEBA. It's an acronym, stands for the State Health Insurance Benefits Assistance. I'm sorry, Senior Health Insurance Benefits Assistance. And we are your local Medicare information resource. So anything that has to do with Medicare, we're kind of the middle of the wagon wheel because we have spokes that go out to Medicaid and Medicare savings programs and the Extra Help program through Social Security and Medicare Advantage plans and prescription drug plans and retiree plans and Medigap plans and you name it. We're kind of in the middle of all of that Medicare related information.
Well, Donna, I don't know if you heard the previous conversation. There's wondering how some of these plans are affected by the end of the public health emergency.
So the beneficiaries themselves that are in Medicare or Medicare Advantage plans or prescription drug plans aren't going to see a big change. Mainly, it's going to be the folks that turned 65 and maybe didn't enroll in Medicare and their Medicaid benefits continued during the public health emergency. And what we're telling our consumers, even though the state says it's not a requirement any longer for people receiving Medicaid to pursue Medicare at this point in time, we're really hoping that people will go ahead and enroll in Medicare before the public health emergency lifts and get that squared away, because if they arrive after the public health emergency has ended, we are not certain that they're going to have a special enrollment period specifically to join Medicare. So I know there's a proposal on the table, but I haven't seen anything that is passed or in legislation now that is going to guarantee those folks that they can enroll in Medicare if they are past their initial enrollment period. Now, one saving grace is we do have general enrollment coming up in January, February, and March, and the rules have changed a little bit for general enrollment. Typically, when somebody misses their 65th birthday initial enrollment period, and they enroll through general enrollment period, the delay has always been to have Part B effective July 1. And in 2023, that is now changing, and it will be the month following the enrollment action. So if they request enrollment in January, it'll take effect February 1st, February and March, and of course, March and April. And that's going to certainly help folks get into the Medicare program sooner than later. And that'll be a benefit to them. And I'm happy to answer any questions that you guys may have about Medicare. We got 2 minutes left before I have to head towards Newburgh.
I'm curious if any of our partners here work with clients that are looking at these benefits.
We refer people to SHEBA all the time. You guys are great. You all are great over there.
Oh, I tell you, I just cannot speak highly enough about our counselors because number one, this is pretty heady stuff. They spend a lot of time training and making sure that they're giving accurate information. And if they don't know, we encourage them to say, hey, I don't know the answer to your question, but I'll find out. And they can always either research it themselves or come to the state office and we'll research it. If we don't find the answer, we can always go to the CMS regional office in Seattle. But our call center yesterday was hopping and we had 10 people answering phone calls and we had 7 people in the queue, which was really unusual, but we managed to get through everybody. So I'm really glad open enrollment's over. And thank you for your referrals.
Well, and thank you, Donna. I'm sure as as I learn more about the program, more questions will be coming up.
Happy to come back anytime. Just let me know.
It sounds good. And we'll turn it over to one of our self-sufficiency programs. I see Vicki is with us. And so Vicki, if you want to give us some updates about TANF, that would be great.
Hello all. So I just wanted to share some updates for TANF policy that are going to be effective January 1st. As of January 1st, cash benefits will be able to be replaced in 3 following situations. So if an individual that was receiving cash assistance and their benefits were removed from their EBT card because of a skimming or a scam situation, then the benefits can be replaced. There's some criteria that goes along with that. And then we also have a situation where if ODHS, the participant, the applicant, the family member reports that somebody is no longer in the household and we don't take that family member off of the EBT case and those benefits are used, then we can replace in that situation also. The third one is if ODHS issues an EBT card to somebody not in that household and the benefits are used there, then we can also replace in that situation. Another great change that's coming up for cash assistance when a person applies for assistance, the face-to-face interview requirement is no longer required. The interviews can be conducted over the phone. They can be conducted in our offices or offsite if the applicant requests that. The last change that I wanted to visit about is we're going to change a little bit on how certain American Indian or Alaska Native benefit payments are being excluded. And it's very specific. If it's not excluded by public law, it will now be excluded. And some of this is for profit share per capita from tribal casinos, income derived from land not held in trust by the Secretary of the Interior, such as timber sales or sale of oil reserves, and then judgment funds to members of the Confederated Tribes of the Umatilla Indian Reservation. So those are some really great changes that are coming for us. And that is it for me, unless anybody has questions.
Well, those are 3 big things between the policy changes in TANF and what we talked about last month with ERDC. There's a lot of changes coming January 1. But I don't see any questions. So thank you so much, Vicki. And I know it wasn't on the agenda, but we do have Lucy with our SNAP policy team, just to give a brief update of some things that are happening among SNAP.
Yeah, I think our main update is what we keep sharing. We have emergency allotments approved for December, and we're putting our application in for January. And we have to wait until the 15th of every month to apply. So we have it ready. Once the 15th hits, we will be putting that application in. That's it for SNAP.
Yeah, like Jillian talked about, we'll continue doing those through the public health emergency, which will continue for a little while yet, we're happy to say. And Nate, you have your hand up.
I know it's not my call, but I want to ask a question while I had Vicki and Lucy on. I know as we talked about, and it's a great, opportunity for TANF to be able to replace those funds if they're, stolen, et cetera, from EBT cards. That is just for TANF. That's not for SNAP. And I just wanted to verify that in case that's my understanding. But as people look at it, we often think about EBT as all funds come on this card. And so I'm just validating if it's my understanding it was just TANF at this time, not SNAP. Is that correct?
That is correct at this time.
Thank you.
Yeah, the scamming and skimming, that is a much bigger issue and more nefarious than I had recognized. I think there's been some articles about that in the media. And Beth has a good question. Why not SNAP too? So what's the story there?
At this time, we don't have support from the federal government to replace SNAP benefits using federal funds. So we're still looking at what it would look like from an administrative and a budget standpoint, if we were to be able to replace benefits from SNAP using, say, like general fund or some other way of funding. I do think that there's been a push from a lot of advocates nationwide to FNS about, it seems like maybe that might be a good idea to be able to replace SNAP benefits using federal funds, considering how expensive that can be, and kind of relying on every state to come up with a budget request or figure that out on their own might not be the most streamlined way to do it. But I don't have any, I know that advocates are in contact with FNS about that, but I don't have anything concrete about where that's going. Just that at this time, we're not supported with that federally.
All right, thank you for that. Oh, and I'm sad to see Linda had to leave because I was going to give her the floor since she's been asking so many questions. But any other comments or questions? Always imagine putting a cushion in these meetings, and it's actually worked this time. So while you think about that, I also wanted to make sure that we're recording these. I hope you have a chance to take a look at them, that the notes combined with the video recording is helpful. If we need to do something else, I'm all ears about that. And also, I haven't done this in a long time, but if you're interested in giving a little 5-minute introduction on your organization, what you do, I would be happy to hear from you and get you on the calendar. I've got a couple set up for January, but happy to get a list together of organizations who want to describe their work for this larger community. So that was my way of vamping a little bit while you thought about your questions. Any comments? I know last month we had a great discussion. I want to thank the community college and college navigators who participated in that last time. That was really helpful. I hope we'll be extending that conversation with you more soon, but I'm happy to see that Nate and Jillian, leadership from the Organ Eligibility Partnership, are here. So it's a good time to grill them with questions, as was being done earlier. So any other thoughts? I'm glad you can laugh about that, Nate. Okay, all you shy people. Yes, Jillian.
I'll say something real quick. I just wanted to acknowledge James's role with this group over the last long chunk of time and what he has brought to all of you. He's switching to a new role with the Oregon Eligibility Partnership. And so in the future, you'll continue to see James. He just won't be the one coordinating this. And he might be the one in my shoes today, right? Coming in and telling you information, and then you can pepper him with questions that are challenging and intelligent. At any rate, I just wanted to sort of thank James for bringing this amazing group of folks together. Every time I've had opportunity to join you, I've always learned something, and just so a lot of appreciation on both sides.
Well, my hope is, in whatever role that we'll continue this, obviously, and because, and I really think this can even be more, that, more interaction, and it's a comfortable place for our partners to, even if you don't have a formulated question, to just give a little bit of a vent session. We need all those types of things. And it's a jumping off point for further discussions. So I appreciate the sentiment, but I want to thank our partners for really making this happen.
Yeah, and I just want to emphasize on what Jillian said, one, appreciating James and this forum, and really appreciating what James just said around the partners. Hearing from you all is the most critical part, and what James just described about being more about your voice, being able to lead our work. I'm excited for the points that we aren't coming to tell you about the policies that we're doing, but we are coming to say how we have been able to implement the changes that you all discussed and you all drove for us. And I know in many ways that is the policies we're improving because you all are active advocates, et cetera, but truly giving that voice to you all. And that's one of the reasons we're excited to have James come and help us as we think about all these programs around eligibility. And so those that email him, I am sure he will still be emailing with you in certain ways and engaging, because eligibility touches in so many areas. But I just appreciate you all coming and allowing us a place to provide information, but really start to hear across and understand if we're going down the right paths and where we need to adjust.
And we're scheming up some other things too, to give some more time for you to give your input on things as well. So this is not the only place. We're hoping to hear about your eligibility questions and such. So, all right. Technically, we're actually 1 minute overtime, which means we're actually ending 4 minutes earlier than we typically do. So thank you again. Keep the emails coming, and I hope you have a happy holiday, winter solstice, whatever season. And
James, is your email going to remain the same?
As far as I know, yes.
Oh, good for us. Thanks, James.
Yep.
Thank you, James.
Oh, I was going to thank Amanda and even Elizabeth again. I totally forgot. Okay. All right. Anyone sticking around because I have a question, or that just because they haven't hit the leave in button?